So could you kind of walk me through a little bit of what you're talking about with the balancing of the body?
Sure.
And, you know, kind of explain that a little bit in more detail.
Sure, absolutely. Yeah. When we're working with the spine, we locate those misalignments and we correct them, taking the pressure and the irritation off the nerves, allowing the body to communicate with the brain properly. Again, kind of like a proper cell phone signal.
Sure.
And when the body functions better, that means our body can be in balance. I also teach biology at Globe University, and we call this in science homeostasis.
Okay.
Homeostasis is internal balance, and when we're in balance, that's when we get the best quality of life. We get the best amount of health and vitality and energy and all the benefits that come along with a healthy lifestyle. When we're out of balance and we lose that homeostasis, that's where disease lies. That's where symptoms are and all the negative things that we think of. And so we try to, with chiropractic, and freeing up the nerve system, allowing your body to work better, we bring your body back towards that homeostasis, back towards that balance, and that leads you towards greater and greater expressions of health and wellness.
Yes, that sounds really good.
Yeah.
And I know that we would just love to be in balance.
Oh, absolutely.
And I know you don't treat every person the same.
Nope.
So you look at them individually,
Absolutely.
and you kind of go through a little bit of personal touching with each person. So how does that start? Let's say that I walked into your office, and what is it that you would actually first do with me then?
Sure. Yeah, it's a great point. Everybody is unique and everybody's bodies are different. And what we do when you first come into the office is we start with our consultation. And we talk about what are your health concerns, what are your goals, and what are you looking for. And we first determine, is this a chiropractic thing that we could possibly help you with?
Sure.
From there, we'll proceed to the exam and the eval, where we do a nice broad range of testing to determine, are there any areas of interference in your spine and nerve system? If we locate those, I'll tell you what they are interfering with, and then what we can do to help you with that. How long will it take? How much will it cost?
Sure.
So everybody gets a very individualized approach. We also have a scan system in the office where we can do a functional scan of the nerve system, which has been a really great addition to the office. And that allows us to really come up with an individual plan based off of how you're presenting and what's your history like. And not everybody gets the same adjustments, and techniques can be different from person to person, just depending on what you've been through and what you need.
Sure.
And what we identify.
So let's just run through a little bit with someone coming in now. And I know that it seems as if when you go to a doctor, they have you come back every, probably 6 months to a year. And so with you, once you go ahead and see you, then I know that you might have an appointment once a week. And then after how long, depending upon their symptom.
Sure.
But they stay about maybe 6 months,
Sure.
that kind of thing. But
one of the kind of misconceptions too about chiropractic is that people have heard, once I go, I always have to keep coming back. And we tell people that that choice is always yours. How long you want to benefit from chiropractic care is always up to you.
Sure.
And we'll make our best recommendations, and then depending on what your goals are, if you want symptom relief, a couple visits typically will get you there, and then you can decide what you want. And if you're looking for more of a wellness lifestyle, then we're going to see you more often. It's kind of like exercising. It only works when you do it.
Right.
And we don't exercise and get in our best shape and then say, okay, I'm there, I'm done, I'm not going to do it again.
Yeah.
We have to continue to exercise and train and work out to fine-tune our bodies to keep us at that level.
Right.
And so chiropractic can do that whole range, from symptom relief and treating the nerve system to hopefully help those headaches get better, to taking you into that wellness and healthy lifestyle approach, if that's which one of your goals are.
yeah, and that sounds really, really superb, because I know depending upon your level of how much you want to put into it, because no one can make you do anything.
Absolutely.
And you have to choose that.
Absolutely. I tell all my practice members that I work for them. They'll make the decision of what's right for them after we just tell them everything that we know and what can benefit them. And then it's always their choice. They're always free to choose what they want and when they're ready to keep going and if they're ever ready to stop.
Yeah, that's good to know.
Yeah.
And so if someone comes in with maybe a certain pain,
Sure.
and then you go ahead and you go through your consultation with them along with the x-rays, And then that's how you sit down with them, and you also show them, you know, exactly what it is. And then you go ahead and treat that particular symptom. Okay. So they also, how is it that you would determine exactly what needs attention in that person's body?
Okay.
Since you look at all of us individually.
Sure.
You know, I would bring my daughter in to see you. Of course, we would be different. You know, even though we both have the same DNA.
Right, absolutely. When we go through, when you come back in and I show you, if we took x-rays, I'll show you those. If we do the scan, I'll show you that. And I love to educate and let people know and explain what's going on. I think that's so much of what we're missing, is just explaining this is what this means, this is what we can do, this is what we can't do, and this is where we can go with this. And then we look at you and say, this is how I've determined how we're going to adjust you. One of the easiest ways that even you could determine if maybe you have a misalignment in the spine is your posture. One of the first things I look at, just even when you walk in the door or when you lay on our adjusting tables, is how is the head sitting? Maybe is the ear shifted to one side, or is the chin and the nose turned towards you? That could indicate a misalignment in the upper neck. Maybe it's the shoulder levels, and one shoulder seems a little bit higher than the other. I've had a lot of women tell me that, you know, my purse always falls off the left shoulder, but not the right. That could be an indication that the shoulders are off, or maybe they're turned towards you. The same with the hips. Maybe your belt line is a little higher on one side, and you wear your pants higher, and that maybe indicates a leg that's a little longer than the other. So these are all compensations the body has made, maybe indicating there could be a misalignment in those areas. And then when you're on the table, I'll look at things such as your posture on the table, maybe your muscle tone. Is it feeling too taut or too loose? Are the joints moving properly, or are they restricted, and are they really stuck? Does it hurt there? We don't adjust where it hurts all the time, but oftentimes there'll be some inflammation and maybe some swelling there too. So there's a lot of different things, along with just experience and a lot of things that come into play. And then the different techniques that I can draw off of based off of what you're presenting and what will work the best.
Okay, well that sounds really great, because you also look at the whole family together then.
Yeah, absolutely.
So, yeah, and I'm sure you can kind of see them with their dynamics of the father and the wife and the children.
Yep, absolutely.
Yeah,
absolutely.
And so when you pull it in, you actually are considered more in the family line, or?
Yeah, we have a very strong family wellness practice. I see a lot of families coming in, a lot of wellness people. A lot of our practice members maybe came in for initial concern are now more wellness, because they've chosen that that's really where they want their health to go. And so it's not unusual to be in our office and just see kids running around and families chatting, and we do a lot of workshops on family educational topics such as nutrition and wellness and stress and all that type of stuff that a lot of families really, really appreciate. So we do tend to really focus on the family dynamics, because a lot of health concerns can run in families because we live the same lifestyles. And so we want the family to grow healthy together.
And even some poor eating habits, you can probably just help them along with that, and not the sugars before bed, or
absolutely. You know. There are very simple things that we can just help families with, whether it be for themselves or their kids, that are really easy to pretty much implement and make a difference.
Yes, and what a great life to have, you know, with you to help the families, you know, because everyone wants to be healthy, and when you can do that with everyone,
absolutely,
and everyone's connecting, and so it's not like one mom will give their child a pop, and then it's like, oh, Dr. Angela said,
right,
we shouldn't be drinking pop.
Exactly. The whole family needs oftentimes to do it together, so it's not one and not the other. Yeah, very good point.
Yeah, great. I just kind of want to back up about, you know, talking about the body and it being in alignment. And I know that sitting properly, posture, you know, when I was taught to even walk with a book on my head, you know, which showed the spine being in alignment.